Welcome. My name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber. Thank you for joining us for this special edition of the Cross-Industry Update right here in Boulder County. This week, we will cover the regular updates, the data, the information, but we're also going to talk a little bit about vaccine hesitancy and how to overcome a little bit of the vaccine hesitancy in our community, since we know that is the #1 tool for us to move out of this pandemic. You're not here to listen to me, although you've seen me about 200 and some odd times in this community over the course of the last 2 years. I will say this is the first time in over 200 times that I've been in my office, the Boulder Chamber, though. So behind me, you don't see my work office. It is my actual office, and the door is closed, which is why I'm not wearing a mask, if anybody is wondering. So at this point, I'm going to hand it over to Lane Drager with Boulder County Public Health. He is going to highlight some of that data, and I will say it is not trending in the right direction. So please put your questions, any of your comments and questions in the Q&A. I will facilitate the Q&A for Lane first before we move on to our guest speakers today around the vaccine hesitancy. We're not going to take too many because we would like to move on to that topic pretty quickly. Thank you.
Thanks, Corinne. Thank you all for joining. I'm going to go through where things are at right now with our COVID surveillance. So here's kind of start with where our trend line for our 7-day cumulative case rates, just tracking over the entire pandemic. You can kind of see where we've been. And unfortunately, that trend, similar to where we were last year, we're seeing that significant upward trend in the fall. So you can see how significant that spike was last year in November and into December. And again, we're tracking on a similar course, and that's with a vaccine. So again, just really emphasizing why the Delta variant is so dangerous is we have a vaccine, we have vaccination in our community, and we're still seeing this happen. So the red line on this graph really is showing that high transmission. So you can see that we're not even close to getting below that, let alone to get to below the orange line. So we're again trending really in the wrong direction there. That red line also represents kind of the capacity of our EPI team to do contact tracing and case investigation. So you can see that this surge is way beyond our current capacity to really handle. So currently our 7-day cumulative case rate is 253.1 cases per 100,000. So again, well above that 100, meaning high transmission. And again, we want to get below 50 ideally, and would love to get even lower than that. Just to give you a sense of what's happening around the state and certainly within the Front Range, we're seeing high transmission really everywhere. Certainly our neighbors, Larimer and Weld, incredibly high, 376 in Larimer, 427. That slight dip in Weld, still they are kind of leading the area with incredibly high rates. But this is really pervasive across the state and across certainly the metro area. And obviously this is having significant influence on our healthcare system. This is an important one. While this is very busy, just to highlight for you that top dashed line that's blue, that's our kind of youngest kids in our community. They are right now the highest case trends. So it's not surprising that we're just now finally seeing some vaccination for a portion of that age demographic, but they're not all fully vaccinated. So they are absolutely getting sick from the Delta variant, and it is important now that we have additional opportunity to vaccinate that we address that age group, because they are right now our highest case rates. We're still seeing issues with disparity in our community, that as in the last 7 days, 26% of our cases were in our Hispanic Latinx community, whereas overall population, only 14% of our population is Hispanic Latinx. So still a major focus area for public health, that we have those disparities within our community. We're also seeing this unfortunate trend that Longmont continues to have a large portion of the cases, 43% in the last week versus 23% of the cases in Boulder. So the kind of case breakdown, 195 cases in the city of Boulder, 366 cases in Longmont, 127 cases in Lafayette, Louisville, and Superior. And then the other municipalities in unincorporated county accounted for 161 cases. So, so again, really seeing that disproportionate impact in Longmont. Some of that pressure is, as you know, I showed the information about our neighboring counties. So Longmont is obviously bordered by Larimer and Weld County. So seeing, you know, that spillover in Longmont. We're also seeing issues in Nederland, and Gilpin County has pretty significant cases and outbreaks. So we're seeing the spillover from our neighboring counties. This is the most, I think, important piece of what we want to share. And one of the, when we've talked about our goals in public health, one of the #1 goals was our healthcare system and our hospitalizations that we're tracking. This is really the critical place that we've been trying to avoid. We're seeing our healthcare system become overwhelmed. I've heard many stories from different folks. I've heard it from across the state of things that are happening. I heard it last night on a meeting I was on of what it's like for people working in the healthcare system, having to make decisions on who they're going to give care to, and losing patients because there's just not enough capacity to handle what's happening. And this is not just COVID. This is everything that sends people to an ICU. There's only so many people and only so many beds. And the staff are way beyond burned out because they've been doing this for so long and seeing these kind of crisis conditions. So it's really important that folks understand this is what we've been trying to avoid, and it's happening. So we're seeing really critical situations in our hospital. So the average number of hospitalizations increased by 11% in the last week. The North Central region where we're at, bed availability continued to decrease by another 5%. And again, I'm hearing more and more of this from our peers like in Larimer County. So all the trends in the hospitals are really, really going in a negative direction. And again, taxing a workforce that has already been taxed for so long. We currently have 98 people hospitalized with confirmed COVID-19 in Boulder County. And we have 10 staffed ICU beds available. So that's a pretty scary number. And that's, again, ICU beds, not just for COVID, for anything, for people who have a car accident, appendicitis, of anything that's going to require you to need that intensive care. We're starting to get down to very limited capacity to handle things. I mentioned this when I showed the graph before. This is again our tracking of cases, and that line showing what our current epidemiological capacity is to handle a number of investigations and case contact tracing that we have. So we are far exceeding what our capacity is. And so that is an important thing. If you're reaching out to get epi information, epi advice, understand that they do not have staff available to answer phones and get right back to you, that they are inundated with the number of cases that they're trying to track and keep a handle on. We've sadly had 40 deaths since May of this year. So again, we were fortunate to have a little bit of a lull in 2021, but that, you know, starting in this summer, really in May, we've seen that start to tick up again. You can see what happened last year, where a majority of our deaths kind of happened in that big surge in the fall. So again, we're very concerned about what this fall and into winter still may have in store. So we're seeing, as you probably would expect, that testing positivity has also been trending up and significantly. So more of the people who are getting tested are testing positive. So we are up again from last week. So we're actually we dropped just slightly. So we were at 6.7 last week and we're at 6.5 this week, but still that trend has been pretty steep, and we're not necessarily sure that that's going to start to turn down, that this probably is just a small 1 week blip. So again, very concerned about that. We are still seeing fairly good testing numbers. So around 2,500 tests per day average over the last week. So that continues. So a lot of people are still getting tested, which is important. That's our one of our important pieces for early detection. So we really want to encourage people who are ill to get tested. Here's where we're at on vaccination. And my colleague is going to share you a whole bunch more information on vaccines. So this number has stayed fairly flat. We have not seen steep increases. So we're sitting really at for full vaccination of our population, 69.7 of the eligible, and then or 72.7 of eligible and 69.7 of the total population. We certainly hope, again, for those 5 to 11 that number jumps rapidly, and we have clinics going on where there's a lot of availability within the community, and we've got to keep pushing those numbers up. So you can obviously, our 0 to 4s are still knowledgeable, so that's staying at 0, and we really want to see that 5 to 11 climb. We'd love to see it get consistent with our much higher numbers across some of the older demographics, but you can also see that we're still seeing numbers where we really need to boost in some of younger age demographics, specifically 18, 19, 15, 17, 20 to 29. Those are areas where we still don't have nearly comparable rates for some of the other age demographics. So here's kind of where things are at for COVID boosters and third doses. Percent of full immunity that's received as a booster and then a third dose. So why we're really encouraging folks to get those boosters, especially folks in older age demographics, which are, right now it's pretty open to just about anyone to get boosters. So, but definitely folks in those older age demographics really need to focus on that. I want to just briefly mention the order that the state put into place that will take effect this Friday. So it is it's important for folks to know that these orders do not change the local mask orders that we have. So both for schools and for our indoor spaces. So, and in fact, there's not a ton of, I think, application outside of a few major areas that are going to be impacted by this. But what this new state order does is it looks at unseated events with over 500 attendees. So again, we don't have a lot of venues that have that kind of capacity. Our fairgrounds will be impacted likely. The university, who already has vaccine programs, has large attendance, but outside of that, it doesn't apply broadly across our county. This is an order that affects really the metro area. And so it's Adams, Arapahoe, Boulder, City and County of Denver, and the City and County of Broomfield. And what it does is it's requiring proof of full vaccination, so a vaccine passport, to attend these unseated events of over 500 attendees. There is a big exclusion for houses of worship. So again, we have some large churches in Boulder County. They are excluded from this order. And there is a provision until November 30th and then effective December 1st that, given that this may impact some of the events that are already planned, there is an opportunity for folks to present negative tests in lieu of vaccination to attend these events until December 1st. And then at that point, through December 31st, the order will require proof of vaccination. Now I want to turn to our vaccination program, which we're still offering as a voluntary component for businesses. It does require 95% overall vaccine of the whatever entity that is applying. Some important things based on applications we've been seeing as of late: it does not allow folks to have unvaccinated attendees be masked. So it is not sort of an opt-in, opt-out. I know we've shared this in the past, but we've seen applications recently where they're going to have 95% of their staff vaccinated, then they're going to say if anybody is unvaccinated, they just need to wear a mask. And that's not what the program allows for. You can have some unvaccinated people. It is a 95% threshold. So there can be folks in there that are unvaccinated, but it can't be more than 5%. It also does not allow people to test in lieu of vaccination. So you can't bring negative tests. It really is very focused on having vaccinated folks. And as of earlier today, when I checked in, we had 306 applications and we have 251 approvals. So excited for those folks that have taken advantage of this. We know that it has helped some businesses be even more effective. We know that even across the metro area, prior to the governor putting that order for 500, many places have already proactively done vaccine passports. And we also have continued to hear success of businesses offering vaccine events, vaccine days, vaccine hours, that has really actually boosted their business as opposed to been a detriment. So really want folks to take heart and think about that, because there are, when we talked about our population, we have a lot more vaccinated people than we have unvaccinated, and you have greater potential to attract vaccinated customers when you are implementing programs like this. There are a lot of folks who are hesitant to go out to businesses and give patronage because of the risk right now. And the last slide, we'll just make sure goes out for folks, just link to many resources that are out there for folks to get good, accurate information.
Great. Thanks, Lane. We have a couple questions. A couple of them I'm actually going to hold off on because I think the next presentation will actually answer those questions. So new public health order that came down from the state about unseated events for over 500 requiring vaccination and no longer having the testing option as of December 1st. Why unseated? Why not seated? Is there any insight as to why that's the case, why it excludes seated events at this time?
Yeah, I don't have a ton of additional information from the state on guidance documents. I know historically when we've been dealing with the pandemic, people moving around has always been more of a concern for exposure, that you're going to potentially interact with even more people as you're moving around, which was why we had social distancing and capacity limits. So when they're seated events, you're controlling how many people and where they're physically going. So there is less interaction overall with the amount of people in the venue. So, but I can't speak to all the numbers and thresholds that the state chose.
And right now it encourages private events to also require vaccines, which, look at Boulder County, we were already ahead of the game. We have this program, the vaccine verification program, that allows you to not only create that sort of situation, but you can then also remove your masks if you were approved by the program. As you mentioned, there are very few venues right here in Boulder that do house over 500, and a couple of them already are approved by the vaccine verification program and already require vaccine verification. Do you know if have you got any insight as to whether or not this will continue past December 31st, you or anybody else on this call, or if the number will go down, or if this is the first step to further mitigation strategies, such as, restrictions on capacity or diminished other mandates?
I mean, I think the entire state and the metro area certainly need to look at mitigation strategies. So, I've shown you the trends and things are not going in the right direction. So doing nothing else is not likely going to stem that. But at this time, Boulder County hasn't proposed additional orders yet, but I think there is a continued urging the state to look at statewide mask mandates. So we already have one in Boulder County, but that isn't across the entire state. So we know that the state is influencing case counts. So one county can't stand alone. Everyone needs to take mitigation steps. So I think there's a lot of discussion on additional steps, but we haven't proposed limits at this point, or additional orders as of yet. But I think there's a lot of discussion around those kind of topics.
And the discussion would be more, we've seen it. We need our neighboring counties to also do some of these efforts together. So whether it's statewide or metro-wide, some of these efforts might need to happen together. But right now, the order is around 500 unseated public events, and that's what that order is. Does the 69.7% of vaccinated include the eligible include the 5 to 11 now that they're eligible?
Yeah, it will start to include that because now they are eligible.
And why do some of the statistics for vaccination by age, why are they over 100%?
What are we looking at here?
Yeah, I was actually wondering that same question. So you had some of the numbers were over 100%. And while you're doing that, one person asked that they applied for the vaccine verification program about a week ago and haven't gotten word back. They do ask that you give up to 14 days. So I have taken note, and I will check in on the status of your application and get back to you. I'm not running the application, but I'll check in on it. But they do say to give up to 2 weeks. So give it some time, but I will check to make sure that it was received and make sure they get back to you.
I think that's an error looking at the slide that I got from our statistician. I think what they did is they added things across because for most of those that works out, but when you've got a partial and then
it was 106% of the 70 plus, and then it was over 100% for the 31 to 39.
I'll clarify that with our folks, but I think they added across, and that's not what they meant to do. It should actually just carry the
all right.
For those that are, that doesn't, it can't be that way. They shouldn't ever be able to be over 100.
That's a good question. If the state imposed a mask mandate regardless of vaccination status, how would that affect businesses that are part of the vaccine verification program? That's a good question.
It is. I think we've talked about those. I honestly don't expect the state to do that, but I think we would ideally be providing input that we want to have some caveats that if they do put a state order, that it not supersede programs that are already in place, in counties that have them, because we're not the only county that has programs like this. So that is important, but we definitely will cross that bridge when we get to it. But just to let folks know, I don't expect a state mask mandate to actually be issued.
Okay. I'm only going to answer a couple more questions, and then we're going to move on to our guest speakers. The question around booster shots. So there's conflicting information out there about eligibility around boosters. I know I was turned away a couple times, but who's eligible to receive a booster shot at this time?
Yeah, and Elizabeth may be even better to answer this, but from my understanding, I think they've opened it up and encouraged all folks that have been vaccinated and that are beyond 6 months to get a booster. So, but I have heard multiple stories of people who've been turned away. So I think that message to all the providers is still an area that we need to keep focusing on. But that's my understanding, is that all folks that are past 6 months of their full vaccination are eligible and should
or
be
2 months past the Johnson & Johnson. So
Johnson.
Over 18, 6 months past Pfizer and Moderna, or 2 months past Johnson & Johnson. Since they signed the order that says that everybody's kind of at risk by working and living in the state of Colorado.
Yeah.
But I want to point out that I think part of the problem is that you can't just walk in any place and get a booster, because appointments are it might be 3 weeks out. So I think that in some cases, some locations are prioritizing the more at-risk populations. And I think that's the miscommunication that I've heard, is that some locations and some providers are prioritizing, and that's why like I was turned away, because they were prioritizing their populations. And that's what I've heard. But I don't know, the other two speakers, do you have anything else you'd like to add?
Yeah, I mean, it's correct, that information that anybody 18 and up is now eligible for a booster, and with the conditions that you are stating, is 2 months for J&J and 6 months for those who receive Moderna and Pfizer. And it also makes sense. It's just that the order is coming, right? It's coming down through the line of work, and of course it takes some time to get to some teams and so on. But one of the factors that may have influenced the later events where people are turned down because of prioritizing some vaccines, because we were prioritizing vaccine for kids 5 to 11. This is a population that was ineligible until very few days ago, and a very, very important population that was not protected at all, and that we were seeing a lot of cases with them, and changes in the trends in both mortality, but also in diseases. So that's, you know, that's what is making sense. But you are right. I mean, really, we ask for patience. There is enough for everybody. It's just that it takes some time. And as you were saying, Corinne, there are so many clinics around, so many, that really we invite you, just, you know, try to make your appointment or go and see if it, you know, if it is possible for you to get a booster. Some of the clinics that were prioritizing for kids were saying, okay, if you bring your kid, do you need a booster? Okay, perfect. And then they were taking the parents or the uncle or whoever came with the kid.
Yeah. So I was watching somebody call, and she was so frustrated. I said, well, have you tried Walgreens? And they got into Walgreens. Well, then Walgreens was like 3 weeks out, and someone said, have you tried Target? Have you tried Costco? So just, you know, looking at all the places that provide, because you might be able to get in. It just, you know, not just concentrating on, well, I heard BVSD was doing these clinics. Well, those filled up pretty quickly, to making sure that, you know, there are a lot of providers out there, and just to look at all of them, and to realize that you might be waiting 3 weeks. Or if you hear the buses in town, like I heard when the booster bus was in town, people were just walking up, and to be willing to do that. One of the school districts had a clinic for the 5 to 11, and parents were walking up, and they said, hey, have you had your booster yet? Oh, why don't you do it now? And parents were getting it then too. So being flexible and understanding that you might have to try more than one location. Someone just said a month ago, I just walked into one place. Those places are not doing walk-ins anymore. I think now that the 5 to 11, most places are not doing walk-ins. All right, we're going to get through a couple more questions, and then we're going to move on. Are they trying to increase ICU bed capacity to help support some of the gap heading into maybe the winter? I've heard the governor talk about trying to increase some of the capacity, the bed capacity and hospital capacity statewide. So they are trying to increase some capacity and be prepared for some surges, correct?
Yeah, I don't have a lot of information on what the state is coordinating on that, but it's obviously a critical issue, and we are expecting more. We're heading into flu season. There's concerns that it could be a bad flu season. So again, we're going to see more and more stresses on the healthcare system.
And then there's a question about the monoclonal antibody. And I know that the governor did a press conference on Friday about the monoclonal antibody buses that will be going around the state. And someone was wondering if they'll be doing those in Boulder County. And I think there will be more information on the state site, and concerning about where those buses will be. So it's something they should check the state on. I'm going to save some of these rest of these questions because a lot of them might be covered by our next speaker. So Lane, why don't you introduce our guest speaker?
Yeah, absolutely. So I'm very pleased to introduce my colleague, Elizabeth Mendoza. She is really supporting our community, and I think has a lot of great information that you can share within your businesses, really for folks that have been very hesitant to get vaccinated. So there's been so much information out there, and sadly, a lot of it is not accurate. So Elizabeth is going to give you a lot of accurate information about vaccines. And so hopefully you can make good, informed decisions.
Hi, thank you, Lane. And I want to introduce Dr. Michelle Haas. And she has even more information. But thank you for inviting us. So when we talk about vaccine hesitancy, I also like to consider the counterpart that is vaccine confidence. So we want to vaccinate with confidence. And I think that really a lot of people, that's what they want. They want to vaccinate with the knowledge, with the awareness that what they are picking, the choice that they are making is the right choice. And in order to do that, really, we need to hear what they are hearing too, because that is happening in the community, just as you were saying, Lane. They hear things from other, from coworkers or from other parents in the case when it has to do with the kids, or, people around, definitely in social media. And so I think it's natural for people to feel confused because, it's just too much information. And on top of that, other issues that have been, long-standing issues, for instance, the problems with access to vaccines in general, that are a reflection of the problems with access to healthcare. So I think it's just a matter of identifying where is that we are not having or not finding our confidence in deciding at this moment, all right, I'm gonna go get a vaccine now. I didn't know this and now I know it. So different things. So I wanna go real fast first with the easy part, which is the barriers in the access, and this is the easy part, sort of say, because it sounds easy for everybody, mostly for people like us, right? That have access to healthcare, that have insurance, that speak the language, and are used to the healthcare system and so on. Nevertheless, for those who are not really, they lack insurance. They don't have a medical home. They don't speak the language. They may have some sort of limitation because of transportation or mobility issues, etc. That can be enough because it's a big burden. Just getting vaccinated is a big burden, and like being in this particular case, in this group that we are, having to take time off work. Oh, what a pain. So all of these are burdens that add up, and then on top of that, you want to ask people to trust the system and to trust what we are saying, the messages from the government. That's way too much on top of what they hear. So, so we can like to address that quickly. Really weird, and this addresses one of the questions that I just saw in the chat. What are we doing actively? What is everybody doing actively? And there's a lot of stuff that is happening, not just the information, but about the safety and the effectiveness of the vaccine, but bringing the vaccine close to the communities, close to the places where you are, and that includes the workforce, the workplace. There's different initiatives that are, kind of like run from the state, by the state. And we have, for instance, the Vaccination at the Workplace initiative, where people can call for a group that can bring vaccination to their business, literally, and vaccinate their employees just so that they don't have to leave. Then we have other initiative, which is a Vaccination for All, and is all these clinics that you see in key places like the library, like maybe outside of a school or inside of a school, etc., different places. And then we have also the buses, the mobile clinics. And so, and those are a lot. And on top of that, the providers, the always long-standing providers, like, hospitals and clinics, Salud, Clinica, Kaiser Clinics, Boulder Community, etc. Boulder Boulder County Public Health, a lot of options, and then the supermarkets, and then the pharmacies, and then, wow, it adds up. So the vaccine is being distributed, like widely. So that means whatever option makes you feel comfortable, whatever option that you may be able to access, you can find it, and you can find information about places where to get vaccinated in both our Boulder County Public Health website, providers webpage, but you can also find it in the state. in the Colorado Department of Public Health and Environment website. If you use both websites, I can assure you that you'll find an option that you'll feel comfortable with and just take, whatever you feel is best. Some people, and this is true, don't like to go to healthcare locations because they haven't been treated well in the past, and there's a history of being, maybe not respected or not welcomed. But then again, there's so many places nowadays that you don't even have to say to bring your documentation like a legal resident and so on. You don't have to pay. This is free. You don't have to have insurance. You may be asked for this information, like, do you have insurance or you don't have insurance? But the fact that you don't have insurance is not a reason for you to not be able to take the vaccine. So, just please feel free to go to our websites and then you'll find an answer there. Now, there's another issue, which is the digital barrier. And some people just don't use the internet. They can't use the internet. They don't have access to the internet. So there's a lot of organizations that work with communities that are working together with us. That's another way that we are actively doing something, engaging in shared decision-making, but also the outreach to all these communities, people who may not feel still comfortable showing up at places where they are going to get a vaccine. Reach out to those communities and you'll find some answers. They can even give you, well, this is a good clinic for you, ask you questions, this is for you, or even help you to register for a clinic, which is a great thing that we didn't see in vaccines before. So there's people actually over the phone registering you, or maybe can sit with you in the computer and help you make an appointment, etc. So don't give up. There's, the barriers today are addressed widely, and those are part of the things that we're doing. We're trying to do a lot of materials in Spanish because we have a huge or a very large Hispanic community, Spanish-speaking community, monolingual. So we also have that, and that we have in our websites as well. Our websites are in English and Spanish. So, okay. So hopefully with this, you know that if your problem is, oh, what a big problem is try to get to the hospital, that's not the only option. There are more, and if you feel still not sure, please feel free to call us in our call center, where we have bilingual staff, very well trained and versed in all these issues, and even information for about other things that you can access because of the COVID emergency response, both for Boulder County and the state. So please feel free, no judgment. Nobody is gonna report anything about you or ask you for information that you don't need to give, except for you need your name, you need your date of birth. And if you're kind enough, please, if you give your race and ethnicity, so we know who, how are we advancing per ethnic and race groups, but also where do you live? So we have an idea of how we're advancing in vaccinating per areas. And then we know where do we need to work harder, in which areas and which groups. So that's one aspect. Okay, then we can probably move to the next aspect that is also an easy, kind of easy one. People, believe it or not, still today are not friends of needles. And I know a lot of you might be thinking, oh, come on, that can be a barrier. It is a barrier still. Some people are very scared of it. And just let me tell you, and you don't have to believe me, you can go to a clinic, walk in and look at the size of the needles. Look at the size of the dose that you're gonna receive. They are so small. Now that we're vaccinated children is amazing. A lot of children are afraid of the needles. And I've seen, I've been into clinics for kids, and they take so long. Some kids are like really petrified. And once they receive the dose, it's like their face changed completely. Like, I felt nothing. And they are telling the other kids, it's not painful, it's nothing, it's great, it's everything. And they go happy. Then the next step is the side effects. Yes, some of the people, but not all the people, have side effects. These side effects were very well documented during the clinical trials. These are side effects that we kind of expect. It's not that we want them, but we expect them. And we know that they come they happen because of the vaccine, because your body is producing the defenses. It's a very strong, by the way, these vaccines are very powerful. So some people really present strong responses, fabricating all these antibodies, all these warriors against the virus. And then they come and go. They may reach a peak like 24 hours later and then start disappearing. If they don't disappear, you can call your provider and then they will tell you what to do. But usually they disappear on their own, or some people are advised by their provider to take Tylenol or ibuprofen just to control the pain, or maybe fever, headache, fatigue, and so on. And again, not everybody present them. Some people ask often about, or say that they heard that the vaccines can have long-term side effects. And that's an interesting question, and Dr. Has can help me here too. But talking about long-term side effects of vaccines is a little bit a strange question, because we don't really see long-term side effects in vaccines. I think that's a new question, because I mean, we give vaccines, we have been given historically vaccines for a long time, and it's not like we see long-term effect, but that's one of the objections. So no, we have no documentation of long-term side effects of vaccines. We have seen some effects that we didn't see during the trials, thanks to the continuing vigilance systems of the vaccine. This vaccine is being monitored and scrutinized like non-vaccine ever. It's incredible. And thanks to the people that are getting vaccinated, and they feed the systems, I mean, they interact with the system and they fill out these forms. And then that's how we learned that there are other effects that people are presenting that were not documented back then. And that's considering that we have like hundreds and thousands of people that were participating in these trials from different races and ethnies. And still, they didn't report those until the vaccine was distributed widely in millions and millions now. So no long term. Maybe like the myocarditis, and we're talking about the kids, a lot of the parents are like, oh, no, I don't want my kid to have myocarditis. This was something observed in a very small number compared to the amount of vaccines that were distributed and have been distributed. And what we know is that it happens more in a certain age that, interestingly enough, follows the same pattern of a regular myocarditis before even COVID happened. So it's interesting, and they recover. These effects, occur after a few days, and then they go away and recover. Versus the kids that get myocarditis as a result of getting COVID. Now that's a problem, and that can linger for a long, long time, and that can limit their ability to participate in sports. So that can be an issue, but not with the vaccine. That's another thing. Another very important is fertility. Some people say, I don't know if I want to give my kid, because I've heard that affects fertility, and that we have no proof that this is the case, that kids are affected, or even adults. I mean, to the point that we are recommending, and highly recommending for women to get the vaccine when they're planning to get pregnant, or they're pregnant, because we know that pregnancy is a very high risk scenario for developing bad cases of COVID. So no, that is neither true, and there is no studies. If you hear this, because this is the common thing that people say, oh, I read in a study, but I would, sometimes when you ask, well, which study is that? And what was the design of it? And then people will go, well, I don't know, I saw it on Facebook, but that's not really a good source for scientific reference. So really, I'm telling you, and this, I think we all here spend a lot of time reading the stuff that comes every day, the scientific research, and no, we haven't found anything like that. And now, I would like to go to Dr. Has, because I'm sure that you have some things that are kind of like threatening the confidence in the vaccine that you can share with us.
Yeah, I can certainly talk about some of the concerns I've heard from community members and from my patients. So, so I'm an infectious diseases physician. I've been in practice for for 12 years as an infectious diseases physician. And so I actually saw patients this morning and encountered someone who was concerned about getting their vaccine. And the concern, and this is a consistent concern I've heard, is that, oh, well, they were developed so fast. And so I want to give it more time. So that's one concern. And then this person was concerned that there was a microchip in the vaccine as well. And so I think, my approach is to say, okay, let's talk about that. I know you've heard this before, and kind of walk people through that and really try to be open and welcoming. I mean, I think a lot of what I've seen from patients and just from community members is folks just want to feel heard, and they want to just, it gets back to that confidence issue, and just, making sure that people, folks don't feel judged, that they are in a compassionate environment where they feel like they can get their concerns answered. And so the concern about the development, so we talked about that and talked about how the technology for these vaccines has been in development for, I think the original postdoc started her work 20 years ago or longer than that. And they've used this technology for other, to advance like vaccines for cancer for at least 10 years or so. So the technology is not new. So we talk a little bit about that. And then we've talked, I just say, well, I understand that there's this concern about the microchip, but that's not really, it's not something that could actually be done. And so that's not what's gone on in terms of, that's not what's in the vaccine, to just kind of address that. So I think it's just really listening to folks, figuring out where they're at. The fertility question has been something that has come up. It's kind of been interesting to see the evolution. Like it was something that was a concern expressed in the beginning, like January, February, and then it seemed to quiet down. And now I think since we're vaccinating children and younger adults, that's become a more prevalent concern that's been expressed. And I say exactly the same things that we've kind of talked about in terms of like, there's no evidence that it's very safe for pregnant women. There's actually a higher risk of miscarriage and pregnancy-related outcomes if pregnant women acquire COVID disease. So we talk a little bit about that. And then I think the other thing is folks are just worried about missing work. So the practical stuff like, well, I don't, if my arm is sore, I talked to a nurse today who didn't want to get their booster because she was afraid it was going to affect her workout. Little things like that, which actually can kind of delay someone getting their vaccine. So I think, being open to addressing these concerns, I think is probably, and having one-on-one conversations with folks, I think is going to be one of the many ways that we can kind of move things forward.
So I have a couple, so thank you very much. You did actually really respond well to how you're actively, talking and going out into communities to talk about vaccines. We're talking to business leaders here. So you're talking about one-on-one with patients, and a lot of these business leaders have had to take on some roles that, we're asking them to do vaccine mandates, and we're asking them to require employees to be vaccinated, whether federally or locally. And we have HR managers and business managers who are requiring their employees to get vaccinated, and they're not doctors. And
right.
So they have their employees come up and say, with these concerns, and they're going to have to say some, give them advice or tell them, they don't know what to say to them. So what do you say to these business leaders who need to tell their employees who are a little hesitant about getting vaccines, where to go to get this information? You're seeing these patients one-on-one.
Mm-hmm.
They can go talk to their doctor. They can look at resources on a website. But what do we do to overcome some of these hesitancies that they're seeing with their employees, that are making their employees actually quit their jobs because
Mm-hmm.
they don't want to be required to get vaccines?
Yeah, great question. So I can, so I had this come up with me on my team actually. So I wasn't the provider, I was, the supervisor. And so one of my staff did not, was choosing not to be vaccinated. I think it's important to sort of stay in a person's lane, like you're not their healthcare provider and not their counselor. And then, so, just respecting some of those boundaries, I think is important. And so how I tried to navigate that, because it was very difficult as a provider and, doing community engagement, is I let that person kind of come to me and, voice their concerns. And then I would, sort of answer, just, as they kind of gave the question. And if I didn't know the answer to the question, then I would say, all right, I'm going to point you to this, particular resource. I was fortunate to have an FAQ document. We could kind of go work through that. So, I mean, that if businesses need that, Elizabeth, I don't know if that's something we can provide.
I would love, we just had someone request that.
Okay.
We have a mask. We have
Mhm.
a mask script that says if they say yes, you say this. If they say no, but someone just said it would be great to have a script or a talking point to say if someone says this, we point them to this. If they say this, we point them to this, because we're asking our leaders and businesses to play roles they've never had to play before, and in some cases play physician, and they're not physicians, and because we're asking them to mandate. So that would be a great resource that we could get out to businesses to help at least push this overcoming of vaccine hesitancy, or push people in the right direction, beyond just this is where you can get your vaccine and we need you to do it by this date, or your job might be on the line. So that kind of thing.
Yeah, I think, and just to name, it kind of, so, I mean, it seems like everyone has their own version of an FAQ. So CDPHE has like this long list of questions, and I think theirs is good. It's incredibly detailed. I think it's at a 12th grade reading level, and that, that might be a lot for someone, for, some folks to take in. So I think, we can point to other sites where it's just a little bit easier to digest, like in terms of the information, and point you guys in that direction too, and then make sure it's translated.
All right. Well, why don't we try to come up with something here in this area? I'll work with the team here and see if we can get out to businesses. I think that is, because I think there's the individual, and I have to say there's some, to answer some of the other questions, we are going to where people are in a lot of cases to try to, provide vaccines where they are. In some cases, where you trust the most is your employer. So having the employers bring in vaccine clinics to those sites. But I just wanted to ask that question because listening to you, I'll go to my doctor, but sometimes it's my employer having that conversation with me, especially with these new federal mandates and OSHA mandates and some of those pieces.
And I would like to add real quick to this. I mean, let's not forget the power of the sharing your personal story and inviting other people in the workforce sharing their stories, because it's true. I mean, the reality is that whether you are a physician or you are a scientist or you are not, or you are, it doesn't matter what you are. At the end of the day, we make decisions, and some of us, we have access to certain information and others don't. But at the end, you make a decision. And even people without medical training, of course, and scientific, that will be silly to think that only those who are trained are going to make the best decision. Other people have made a decision, and thank you for that. What was the process that they went through to decide, I am going to take a vaccine because of these elements? This is enough information that convinced me this is the right thing to do. And the same for my children, right? I am amazed. I want to say, for instance, in the case of children, and this is just a simple example, myself as a experienced researcher and published, and a physician as well, when the vaccine for kids was going to be approved, I thought, well, my kid, she's 11 and she has always been over 95 percentile. I'm not liking this dose that they're going to be using because she's too big. She might fall short. And then, that was for a moment, like a parent, of course, I was like, I don't know about this. And then I was like, well, wait. The methods that are used for vaccines are different than the methods that we use. My experience in clinical pharmacology of drugs. Then I don't think that, no, wait a minute, this is different. This has to do with age. This has to do with other parameters, so she is going to be fine. And the same I've seen with parents have said the same thing to me. And even the opposite, saying, oh no, but my child is so small, and so on. Is like, well, you'll be impressed. This is designed by age, although there might be some issues with weight, but not because of the vaccine. So, you share your personal story, how you decided for your kids, and share your concerns, really. One thing is, I'm concerned that the recent thing that I heard, how about natural immunity? How about, that, because I've read, which a lot of the cases they didn't read, but they heard that there are studies that say that natural immunity is more powerful than acquired immunity through the vaccines, or induced immunity through the vaccines. And really, it's not really that safe. I mean, there is no conclusive evidence that says that it's true that natural immunity, but through the getting infected, is going to give you a stronger response. There are many, many things still in waiting to understand. Nevertheless, what is safer? That's the thing that you have to, should I play roulette rules and the Russian roulette and say, oh, I'll get COVID and hopefully I don't die from it. And then I get powerful immunity, that kind of thing. So my concern in that sense is, yeah, it might be, I don't think so. And there's actually a recent study that demonstrates the opposite. But vaccination doesn't make me more prone to dying, and definitely gives me protection. That's controlled. That is a study that's documented.
Well, so you're actually answering one of the questions that just came in. So, vaccine doesn't prevent you from getting COVID, but one of the questions was that it's gonna reduce your risks of getting extremely sick and reduce your risk of dying and reduce your risks of getting being in the hospital. Much lower percentage of those people that are in the hospital in the data that Lane showed are vaccinated. I can share an article in I'll share an article in my email that I send out that was put out by Boulder County Public Health about a hospital and the percentage that are in the hospitals that are vaccinated versus unvaccinated. But it does reduce your risks of being severely ill and ending up in the hospital and of dying.
Corinne, I just want to add to that. So it does reduce your risk of getting ill, and it absolutely reduces the potential for severity. So I think what you said is accurate, but it does help prevent disease in the first place too. So it's not just that everybody's still going to get sick with COVID, you just won't get as sick. But we are seeing with the Delta variant a lot more breakthroughs. So that is the concern, is that this virus continues to evolve, and we don't want it to continue to evolve beyond, the Delta variant to something even worse. But I think the biggest underlying thing is really go and find out. Don't just listen to word of mouth. There's so much out there. And people will even quote things, like, this is from the CDC. Go see it yourself. Go actually there. And honestly,
my favorite superstar said this, or my favorite athlete said this.
It's really important. I mean, the CDC actually has a site for people to self-disclose anything they believe may have happened from the vaccine. It has no actual verification. It's just a reporting system for people to put things in. So when you go there, people will say 7,000 plus people have died from the COVID vaccine. And that 7,000 entries have been made. Those are not verified deaths. In fact, that's not true at all. If you go through the list of the things people have put, people have gotten splinters, they've had their teeth extracted, they've had car accidents, they've been bitten by snakes. So again, you really need to understand, and there's tons of disclaimers, but people will still grab that and say 7,000 people died of the COVID vaccine, and that is not a fact. 7,000 entries have been made into a complaint system. And again, none of it is verified to be actual cause and effect. So it's really important that you go to trusted sources. Our call center can help direct you if you don't, have, as Elizabeth talked about, access to internet to get good information. But we've shared a lot of links that'll go out in Corinne's email to get that good information.
Do you have that number of breakthrough cases in Boulder?
I haven't seen it lately. It's always hovered between 20 and 30% for hospitalizations and around 20% for deaths. So it's definitely fluctuating. I know I've seen some of the Jefferson County recently. It was about 25% of vaccinated people for deaths and about 33% for hospitalizations. I think ours were a little lower in Boulder County, but those numbers have been climbing. So at the beginning of the year, when we were seeing vaccines rolling out, we saw less than 5%, less than 1% of hospitalization deaths from vaccinated people. So Delta variant has definitely been a big game changer. And again, we're very concerned about future variants. So, vaccines are still our #1 defense, and people really need to pursue it.
You're not wondering about hospital or deaths, like actual cases, the breakthrough cases.
That's a little bit higher even. So I don't know what it is currently, but it is that I think it's even maybe over.
The state's website's doing a better job of tracking breakthrough cases. If you go to that state link that I send out with my emails of tracking the data, which I could find when I'm not doing both items. If you go to that, it does show the percentage of breakthrough cases a little bit better. It might be a little higher than the hospitalization percentage.
It is.
Okay, just real quick, I'm gonna see if there's any other questions. Oh, just really quick, are you finding increased resistance or anger? Maybe anybody could answer this one around the mask mandates, or more people doing more insults, or, more anger from the public around the mask mandate locally or in other counties?
I think more in other counties potentially, but it's happening. I don't think it's pervasive. I think it depends on the culture that is also being created within the business of, if you're taking it serious, then you're probably going to get patrons that take it serious. If they feel like you really don't care, you're going to get some folks that don't. But I think we're still seeing fairly good compliance. We have a few problems spots, but for the most part, we're not seeing pervasive problems across Boulder County.
I think we do have some nasty people walking into places that take it very serious. I know that in the city of Boulder, we've been taking pretty big efforts to distribute masks to businesses, because a lot of people are coming into the area without masks. The Boulder Chamber, the Downtown Boulder Partnership, and the city of Boulder partnered to distribute over 65,000 masks before homecoming weekend and on big weekends, and before, just because we found that if we have masks available, they become a little less nasty at times, but people are aren't as friendly as they were probably at the beginning of the pandemic. So I think people are not as nice about it, especially if they're coming from areas that don't have mask mandates. I think people that are from our area or from areas that have mask mandates might be a little more more understanding. So I think people, I think people are not always, and some people are saying I don't shop when they don't have a mask requirement. Some people are coming to Boulder because they do have a mask requirement. They won't go someplace else. But then some people are surprised and they're coming in and saying, wait a minute, no, I don't do this. So we're seeing a little bit of both.
We do have a script that we've kind of put together to help people have some of those conversations, to avoid it being just a straight conflict, and again, pointing to, first off, there's an order that requires it. So it's not just that the businesses are trying to be discriminating, and it's really to protect everyone's health, the people that work there as well as everyone else. And obviously, if they have masks available, that makes it even easier that, you forgot one, or here's one. So
yeah. And we found that if you just like, hey, buddy, just put it on, and it became a little easier than, I'm sorry, I can't let you in. And they're like, wait, what? I can't. So whatever we can do is to reduce some of the barriers. I think at some points that is the case. So at this point, I think there were just some questions about some data. There's some data on the websites. I think there's still, if you go on the state website, Boulder's website, the Metro Denver's website, Denver has actually some good data on their websites. I think there's always requests for more data, exact data. I think, with public health being as busy as they are, they're not always able to get to the minutia of the data that's always requested. So we appreciate everyone joining us today. I think we have a couple yes on that. Let's get a frequently asked question, or how do we have conversations with our employees? So we'll work on that. We are going to hold a webinar in 2 weeks. Lane and I are going to hold a webinar in 2 weeks. I'll get information out about that 2 weeks on Thursday. I think it's the 2nd, to give you an update on the data. Have a wonderful Thanksgiving. Have a safe Thanksgiving. Make it a safe Thanksgiving, and let's hope our numbers go down, not up, between now and the 2nd. Thank you to both of our special guests today. I appreciate you joining us today and giving us some very valuable information and ways we can talk about it. And thank you everybody for your time.
Thank you.
Thank you.